Kate Hilliard here, registered dietitian here at the Antonio E. Garcia Center. And today we're going to be covering, with diabetes, everything sugar and salt. And so when we get into diabetes and we talk about sweeteners, artificial sweeteners, it can be very confusing, especially when you want to keep your blood sugar in check. And also when it comes to salt and sodium and what things have it in there, what's the right amount of sodium to intake. So we're going to cover all that in today's topic. So in diabetes, we talk so much about sugar, right? Because we want to keep our blood sugar in check. We don't want our blood sugar to rise. So one thing that will make blood sugar rise very quickly is sugar. So just your pure table sugar that you may have at home. Even things like brown sugar. Now some people think that it's healthier because it's brown, meaning it does have some molasses in there which have some nutrients, but overall, it's still sugar, and it still will raise your blood sugar. Even things like honey or agave nectar are sweeteners that can also raise sugar. So about 1 teaspoon is considered 1 carbohydrate serving. Now there are a ton of other options that we're going to look into. So just as there are natural sweeteners, there's also artificial sweeteners. So artificial sweeteners don't contain carbohydrate and they won't raise your blood sugar. So when you think of things like diet drinks or Splenda, things like Sweet and Low, they won't raise your blood sugar, but still be cautious. We don't see enough studies done and long-term studies to see how it affects overall weight. Some of the recent studies have even shown that it can cause prediabetes or type 2 diabetes a lot quicker in someone due to mid-abdominal weight gain. And some of the reasons for that could be if you're craving something sweet and have a diet drink or something that's artificial, you're still not really satisfying that craving and could potentially eat more sweets or desserts or something that, of course, is going to be high in calories. So just being careful to balance that out. Now, if you have diabetes and you are in a decision between a regular cola or a diet drink, just know that the diet will not raise your blood sugar versus the regular one will definitely spike it. And so in the short term, if that's one of your goals is just to keep blood sugar in check, then artificial sweeteners and diet drinks may have a place. But if your goal really is to be healthy and have weight loss, of course, the less you can drink of the regular and the diet, the better off you're going to be. And so looking at some artificial sweeteners that I'm sure that you've seen, especially when you go out to restaurants and things, are your Sweet and Low. So that's your pink packets. And so Sweet and Low is actually what we call saccharin. So artificial sweetener, and it is actually sweeter than sugar, like most of your artificial sweeteners are. Now, of course, being careful as well as portion sizing. So if you are using any of these sweeteners, to make sure that you are keeping it to at least 1 packet, no more than. So some other artificial sweeteners we have here is Equal. So that's our blue packet. And this actually contains aspartame and ACE potassium. Now, it's important to know that something like Equal has potassium in it because if you are on dialysis or have renal issues, you need to be careful of potassium intake. And so if you are on dialysis, this is not recommended as an artificial sweetener. But again, something like Equal is going to be sweeter than sugar. Now, something to point out is that other countries actually do ban some artificial sweeteners. We're in the US that we're a little more free and liberal with it. So again, as your dietitian, what you do is more natural, the better that it's going to be. Now the one that I didn't bring that's very popular is Splenda. So Splenda is sucralose. So if you ever see it on a drink to see sucralose, to know that the brand name is going to be Splenda. And that's another one that's used mainly for baking. It is a good substitute for baking, but again, is artificial. And so just being cautious about that. Now on the flip side, and what I love to talk about, is more of your natural sweeteners. So these are things that don't come necessarily from sugar, but from other sources like plants. So if you've ever heard of stevia or Truvia, this is a plant-based sweetener, and one I highly recommend if you want to have a replacement for sugar. And this goes well with baking, it goes very good in drinks, or sweeten things up like oatmeal or your cereals. This does not contain sugar, very low in carbohydrate. Same thing when we look at things like are other names for it. So stevia is the plant, but you may see the brand name Truvia. You may see it as Purevia. And so there's lots of options out there. There's also drinks like Zevia, which is a carbonated beverage that uses stevia as its sweetener. So again, lots of options. Now, really popular ones that are coming out is something like our monk fruit sweetener. So monk fruit does come from a plant in Southeast Asia, and what they do is they take the fibers and the powders and they grind it into a type of sugar looking like substance, but really it is full of antioxidants and has a nice, very sweet taste, sweeter than sugar, so you still have to be careful with how much you use, but it has no sugar, no carbohydrate. And so this is another very popular sweetener that's coming out and was just approved by FDA in 2010. So we are seeing it used more and more. And again, it's called monk fruit. And you can definitely get it in little packets, or again, if you want to bake with it and use a little more, this is another option that you have. Some other things that are out there that do have a little bit of carbohydrate are things like coconut sugar that you might see, sugar in the raw or sugar cane. Those again they're natural sweeteners, but they tend to raise your blood sugar a little bit, so being cautious. But another thing we're also seeing is blends of the two. So coconut sugar with monk fruit to reduce the carbohydrate in there. And so just looking at the options, always read those labels to know exactly what you're getting, and just have fun exploring all your sweeteners. So one thing that's very important to discuss is something called sugar alcohol. Now, sugar alcohol is not a sugar and it's not an alcohol. And so the name can be kind of confusing, but it comes from the chemical structure. And it is a sweetener that will not raise blood sugar. However, there could be some other consequences. They actually use types of sugar alcohols to be laxatives. And so if you've ever had too much of sugar-free cake or sugar-free candies, you may have felt the effects. Things like bloating, gas, and also, obviously having to use the restroom. So you need to be cautious about your sugar alcohols. But those are things like mannitol, xylitol, sorbitol, so ones that you may see in things like sugar-free gum or even sugar-free cough drops. So just making sure you know how sugar alcohols affect your stomach, because they don't get digested, so again, can cause a little discomfort there, but they won't raise blood sugar. So with all this sweet talk, let's look at what are some acceptable beverages to have when you have diabetes. Now, there's lots of little single serving sizes of your drinks, and this one is a True Lemon brand that has stevia extract and some lemon juice extract in order to kind of flavor and sweeten the drink up. Now, there are things like Crystal Lights, but you need to be careful on what sweeteners they use. A lot of times it could be aspartame, it could be sucralose, and what we already mentioned about sometimes artificial sweeteners aren't the best if your long-term goal may be weight loss. Again, however, if you need to get more fluids in, drink more water, and keep your sugar in check, then there is a place for them. But always the best thing that you're going to be able to drink is always going to be water. No matter what, filling yourself up with water. Our bodies are almost 70% made up of water. So this is really the ultimate best beverage and drink you can have for diabetes and for your blood sugar. So making sure that you're staying hydrated with water. Now you can always flavor it with lime juice or lemon juice if you prefer. If you do like the carbonation and kind of miss that with some drinks, there's options of sparkling water, and there's a ton of different brands out there. But you, again, want to look at the ingredients to make sure that it's not trying to add any artificial sweeteners in here. So this drink I have here is just carbonated water and natural flavor of the lemon that it's flavored with. So those are always going to be the best. If you want it to be a little sweet, that's where you can add a little bit of stevia or Truvia to it, or some monk fruit, in order to sweeten it up a bit. But this is for if you do miss that carbonation, that it is a great option for you. So our other topic to cover is salt or sodium. And you may have some just normal kind of table salt at your home, but I did want to cover some other salts that are available to you. Now, many people with diabetes also have high blood pressure. And so that's where watching your salt and sodium intake is very important in order to keep your blood pressure also in check, as well as your blood sugar. Now, with our salt and sodium intake for someone with diabetes, it's recommended to have no more than 2,300 milligrams of sodium for the entire day. This is where, when you read those labels and see how many milligrams of sodium is in the foods you eat, you can kind of calculate to know if you're having way too much or not enough. Most Americans have 3 to 4 times that amount, and sometimes even in just one sitting. We get most of our salt and sodium intake from eating out and from processed foods. So those foods that, things like chips, packaged cookies, packaged snacks, and of course, eating out at restaurants, fried food, all that contains a ton of sodium and way too much for most of what people need. And so just to kind of give you a good visual is 2,400 milligrams of sodium is 1 teaspoon of salt. And so I did mention 2,300 milligrams for someone with diabetes, so I put a little less than our teaspoon there to kind of represent how much. Now, I'm not opposed to salting food if you're cooking it at home, because you can control how much that you're putting into it. But again, making sure that you're watching how much that you're actually adding to it. Now, I do get a lot of questions on things like sea salt, and is it better than something like kosher salt? And really, salt is salt. It has the same amount of sodium ounce per ounce, teaspoon per teaspoon. However, if you do get something like a sea salt that has more of a coarse grain, you tend to use a little less. Because they're bigger crystals, you get a punch of more flavor when you are eating something that has some coarse sea salt on it versus more of a refined salt, which you can easily add way too much. And so for some people trying to control their sodium levels, doing a coarse sea salt may help in controlling how much salt that they're actually putting in there. But again, nutrition-wise, there really isn't any difference when it comes to the sodium amount. Same things when you get into Himalayan pink salts and gray salts. Those colors come out because of the nutrients that are in them, although you get a lot more nutrients, of course, from fruits and vegetables, which is definitely easy to use when you're adding, definitely a great thing to use for that salt and vegetables to flavor them up a little bit. The other thing to be cautious about will be things like seasonings that have quite a bit of sodium and salt in here. And so being in South Texas, I know we have a lot of our tahini around, and knowing that this is very high in sodium. Now, you can use great substitutes for salt and sodium with all your herbs and spices. That's always the best way to flavor your food, is with fresh herbs, fresh or even dried spices. All will go very far, and many of the times you don't have to add additional salt to it. And with our palates, we're very sensitive to salt. We get used to and adapted to how much that we actually intake. And so if you've ever noticed, for some people, they can eat the same type of food and one can say it's super salty while the other one needs to dump more salt on top of it. The reason being is because we become adapted to how much salt that we intake. So the best way to help reduce your salt intake is to slowly wean yourself off of how much sodium that you actually put in. And over the course, about 2 to 3 weeks actually, our taste buds can pick up more subtle flavors where we don't need to add any additional salt. This is a good recommendation if you are eating out and tend to be one that salts your food when it comes to your table. Like I told you, a lot of times at restaurants, there's way too much salt and sodium in the meals that are prepared. So being cautious about trying not to add additional salt and slowly getting your taste buds used to eating more natural foods that aren't as salty. Now with your salt as well, the more salt you have, the more fluids that you need, because you tend to get thirsty, right? So again, being able to reduce how much salt you're doing, but still keeping your water intake is really going to help your blood pressure, really going to help your kidneys. And so again, for the long term, that we want you to be healthy with not just your blood sugar, but also your blood pressure, your heart, your kidneys, and everything else in your body. So just to recap what we talked about in this segment on things of sugar and salt, remembering that things like regular sugar, brown sugar, honey, agave, cane sugar, raw sugar, all those will raise blood sugar, so we need to be cautious about consuming that, as well as knowing that there's a lot of artificial sweeteners out there that we also have to be cautious about. Now, natural things like monk fruit, like stevia, truvia, so plant-based sweeteners are always going to be optimal for best blood sugar control. And then there's a lot of great beverage options out there. Just always making sure you're checking those ingredients to know you're getting natural ingredients included. And remember that the best thing to always drink is always going to be water. So that's the thing that we want to get the most out of. And then when it comes to our salt, to know that all salt is created equal, and so the sodium amount is going to be the same across the board, so that one isn't healthier necessarily than the other. But watching our salt intake, knowing that we get it mainly from eating out, from processed food, frozen foods, fried foods. And so controlling it when you're cooking your own meals at home and just adding a little bit for flavor. But remembering that instead of high sodium spices, that you can always use just natural spices and herbs in order to flavor your food. And so I hope that you learned something today about sugar and salt. So make the best choices for your blood sugar.